नमस्कार मेरे प्यारे दोस्तों। मैं हूं प्राध्यापक डॉक्टर राजेंद्र रघुवीर देशपांडे। माई सेल्फ इज प्रोफेसर डॉक्टर राजेंद्र रघुवीर देशपांडे. I would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. Ayurveda Academy has a team of the doctors who are expert in the different fields, and those who are interested to get the paid online consultation, they can only WhatsApp on 922681060. My dear friend, this is the series where we are discussing the different problems of the patient. So the patient come to the doctor, around 42-year-old male patient. And what is the complaint? Doctor, I have the backache since last 2 months. Okay. Doctor said, okay, please have a seat. Please sit down. I will just check it out. So when the patient is complaining backache, I start thinking whether this is a very simple postural backache because of the wrong sitting style, wrong standing style, wrong walking style. So postural backache. Or is it a sprain? Like a sprain. Or is it something serious? So I have to think. 42-year-old male patient complaining me about the backache. So I started interrogation or the history taking. History taking is the most important part in our medical general practice. So I asked him first question. Hey, my dear friend, is it started suddenly after lifting the weight or bending down? No, doctor. It is not like that. I had never got the type of this problem. Like I had not lift the weight, or I have not get that sprain because of the bending. So I clear cut mark a cross in my diagnosis that this is not acute PID. This backache is not because of the acute prolapsed intervertebral disc. This is not PID, acute PID, because this backache has not started after lifting the weight or after bending down. Okay. So I asked the further question. Just tell me, because it is the lower back, tell me that whether that pain is radiating, spreading to the legs. Yes. You are right, doctor. That particular pain, my backache is going down to the right leg. That pain is going to the right leg. Oh, I see. I thought that this may be sciatica problem or disc prolapse problem. Okay, tell me, is it more when you get up in the morning? Yes, doctor, you are true. This is the case. After getting a little bit more stiff in my back. So this is morning stiffness can be a feature of osteoarthritis. So I have made that this may be sciatica, this may be disc prolapse, or this may be the osteoarthritis. So I ask the patient to first sit down and then lie down on the bed, and I inspect the back and the spine. When after lying down, after sitting and after lying down, I checked the back and the spine. And I asked him, tell me where exactly you are getting the pain. So I have to ask him to show by particular hand or the finger. And then I look for the prominence of spine, or I just press it over there. I tested for the tenderness or gentle hitting. I made a simple touch and also I pressed it over there. But that is nothing very specific. So I then go forward and did the SLR test. Please. SLR test is very specific to diagnose the sciatica. Straight leg rising test. SLR, straight leg rising test, is very specific to diagnose, clinically diagnosis of the sciatica. So I asked the patient to lie down and lift each leg, right as well as the left, up, straight to the 90 degrees. Of course, he could not do that 90 degrees. But when he was lifting the pain, he got a little bit more spasm in the lower back, that is lumbar spine. And so this is a positive SLR test, positive straight leg rising test. So this is going towards my diagnosis of sciatica. That's right. Next, I tested EHL test. I have done that EHL. EHL. What is that EHL? I asked the patient to dorsiflex the great toe against the resistance. I made this particular finger over there and I asked, okay, flex it. Great toe, dorsiflexion of great toe against the resistance. And because this test is very important, EHL. Why this test is important? Because this is the earliest sign of neurological deficit, which indicates that there is a compression lesion in the spine. So EHL test is very important to diagnose the neurological deficit whenever there is a compressive lesion in the spine. Okay. Then I continued my examination. Actually, when it is not a severe pain or it is not that much, but testing of the deep tendon reflexes are also important when we are examining the backache. Exaggerated reflexes, especially the knee reflex or the ankle reflex, these are indicating pressure on the spinal cord. Try to understand, pressure on the spinal cord, that is exaggerated reflex. I also tested for plantar reflex or Babinski's sign. Okay. So now, actually, when I asked to do all these tests, but then I started to manage this particular patient. Okay. But when I was expected to give any painkillers to the patient, I have to ask orally to the patient whether there is any history of epigastric burning. Is there any history of acidity? Is there any history of peptic ulcer? Because this is a contraindication to prescribe my NSAID. NSAID, NSAID, non-steroidal anti-inflammatory drug. Voveron, for example. If I want to prescribe, there should not be history of acidity. Also, I have to check any history of bronchial asthma, because bronchial asthma is more times like allergic. Because this particular NSAID, if the patient is having already allergic tendency, he can give the reaction to my tablets as well. Then if I want to give any steroid, then I asked also about blood pressure, because raised blood pressure, uncontrolled hypertension is a contraindication to use steroid, especially Visolon, prednisolone. We should not use in the case of ulcer. We should not use in the case of hypertension. So what are the most important points in the backache? Have you understood? Number one, is it osteoarthritic or is it a disc prolapse? Then I have to check the local tenderness, then SLR test, EHL weakness, then also wasting I have to check. Then for this particular patient, I thought that I can give the short wave diathermy, SWD treatment. I can give the lumbar belt for the support and bed rest till the acute pain subsides. This is the management. Okay. Then I also prescribe some NSAIDs, like for example, Voveron. I also prescribe tablet Shelcal, which is nothing but the calcium supplement. By chance, if the patient is not showing any result within the period of a week or the 7 to 8 days, then it is better I can check the second opinion with the orthopedic surgeon. I can give the cheat or the referral cheat to the patient to go and visit to the orthopedic surgeon, where the doctor can prescribe X-ray of the lumbosacral spine. If necessary, the orthopedic surgeon can suggest myelography or even the MRI. If there are some neurological deficit sign, then even GP, whenever the GP is finding any EHL positive, that particular dorsiflex of the great toe, this particular test is positive, then it is better to refer the patient, and immediately there may be a need of surgery, but this is very rare. Okay, so I hope that this simple case of backache you have understood, and in this type we will continue the discussion with the different things. My dear friends, I request all of you to please subscribe my channel, and don't forget to press the bell button icon to get the notification. Also like and share this video. Thank you very much, and I wish you all the best and take care. Thank you. Thank you very much.